Well, my practice is primarily a special needs practice for adult patients, and I do see children too, but as far as finding dentists who treat special needs adults is kind of difficult. And maybe some of you have found that to be a challenge to find dentists. Some facilities have dental centers in them. In Chicago, we don't have a lot of dental centers for assistance with treating individuals with various neurodegenerative diseases. So it can be a challenge, and many dentists in private practice are uncomfortable seeing the patients, and you may have found that to be a case. They're uncomfortable with swallowing issues, with managing sometimes some of the behavior challenges, with seeing the patients as they progress. Early on, they're quite comfortable with it, but as the degeneration progresses and they may need some type of sedation for that treatment, it's difficult to find. So we'll talk a little bit about finding some special care dentists, and I'll go through some of the issues that people with neurodegenerative diseases frequently have that are related to the oral cavity. So to begin with, many of these medications cause dry mouth, xerostomia. And when we have a drier mouth, it's more difficult to chew the food, it's more difficult to process, it's more difficult to swallow. Dry mouth also leads to problems with dental decay. So that becomes a big challenge as far as maintaining good oral health throughout the progress of these diseases and conditions, and working with the dentist so that they can provide some other modalities to maintain the health. As some of these diseases progress too, individuals may have difficulty opening, and if you're a caregiver for someone who has challenges with movement and hand control, you can find it be really difficult to get inside their mouths and keep their mouth clean. The psychological effects, as any chronic disease, depression is a big issue. Depression leads to dry mouth, and many of the medications and the fact that as the disease progresses, there's less muscle control. Gastroesophageal reflux occurs in many of these diseases, and that creates acid reflux into the mouth, which can cause dissolution of the teeth, of the enamel, and create sensitivity of the teeth too. So these are all things that a dental exam can check. A dentist can give you ideas to take care of these problems and head them off early on, because individuals who develop a neurodegenerative diseases who are blessed with good teeth to begin definitely can enjoy a better quality of life throughout the progress of the disease. And people who have challenging teeth or haven't maintained their teeth throughout life are going to have some difficult challenges. And as you know, swallowing and eating and speaking and just being comfortable. So here's a tongue just to show that there are changes in the oral cavity. This is a tongue with someone with a neurodegenerative disease. And our tongues don't look like this in general when we're healthy. We don't see these odd waves and depressions and folds within the tongue. Mostly a tongue is fairly smooth. It's got a little bit of ridges on that. So you can appreciate someone who has difficulty swallowing. The tongue is a big part of moving food around the mouth, getting it to the back of the mouth. And if you have issues with the tongue, there's a challenge right there. So sometimes these changes in the tongue will actually precede some of the changes with swallowing. Tooth decay we all think of as the dentist with problems with tooth decay. So we need to maintain a diet that's low in sugar. I know a lot of individuals like to have sweetened beverages, juices, and whether it's apple juice or cranberry juices, and they'd have a more difficult swallowing the clear beverages, so they're nectar thickened, and those things can actually be higher in sugar. And because the sugar is thicker, it'll stay on the teeth longer. Okay, because of a thin liquid would go down, it could be washed away with saliva, but something that's thicker and a little jelly-like is going to stay on the teeth longer and promote tooth decay. So it's nice if you can have an individual that may not be able to swallow, but be able to rinse their mouth, to be able to to get, with just some water, cleanse those areas out so we can neutralize some of the acids and reduce some of the sugars. You may not be able to swallow that, but you can go ahead and dilute that a little bit. Oral hygiene is important. I'll talk about some toothbrushes you can use for individuals when you're helping to brush their teeth. And of course, one of the big things is the host resistance as far as getting to caries. Inflammation, many of these new medications are going to be directed at immune system challenges and antibodies and things like that to reduce inflammation in certain areas. So if you have inflammation in the mouth, the body is already fighting inflammation in one area and can't put its focus along with the help of these medications to reduce and take away these proteins and have their immune system work. So it is important. And it's so challenging. People with degenerative diseases have so many other problems. It can be easily, the mouth can be left to the last. And then, until there's a big problem, and then it becomes almost like a storm, like a tornado, trying to improve the person's health and find a dentist, take care of their mouth. So the preventive care is very essential. Again, we talked about the dry mouth. Burning mouth is not an uncommon thing for people with neurodegenerative diseases to experience. The nervous system is degenerating centrally and maybe peripherally, or the central lesions are affecting the peripheral perception. So I wouldn't be surprised if a lot of individuals complained of burning mouth. And those things can be managed. We can manage them with different types of mouthwashes. They can be managed with even antidepressant medications. So those are things that you can talk with the dentist and the physician about to pursue treatment in those areas. As the mouth is dry, the immune system is weaker. We're not flushing our mouth. Yeast infections are not uncommon in individuals in the mouth. And that would be a red, burning feeling, difficulty swallowing, looking in somebody's mouth. Perhaps it's an individual that wears dentures. And it's great if they can maintain their dentures, because dentures support the palate, they support the roof of the mouth, they make it easier to swallow. But unfortunately, as individuals progress through these various diseases, often they lose weight, they lose muscle control. So it's important that the dentist can follow, possibly reline the dentures. You may use adhesives to keep the dentures in place. An upper denture pretty well. Frequently, if an individual has lower dentures, it's going to be a big struggle as they progress through the disease for them to help to wear those dentures. But then the foods are generally a little softer, and I have to say I have many healthy, normal patients that don't like their lower denture and chew just fine with just an upper denture. So with softer and mechanically soft foods, they can kind of manage to get the foods down. You're going to see taste changes. So a little bit of spice to the food, a little bit of pepper. Food may not taste as good. That becomes a big challenge, and that's referred to the dentist. And if you see any type of bleeding or swollen gums, that's typically not getting in there to clean those areas on a regular basis. Again, the bleeding and swollen gums is an indicator of infection or for certain inflammation in the mouth. And here the body is trying to focus on maintaining this unhealthy mouth, and how can you manage other parts of your body. It's not uncommon to see this, unfortunately, in patients with chronic diseases, because the other areas of the body have become so important, whether it's helping a person in and out of bed, making sure they're clean, taking them to various medical visits, which are one after another, that the oral health lags behind. And so when we get to a patient like this, we can do some restorations depending on the individual. There can be some simple restorations that can be done. They don't all have to have fancy crowns or partials. There's a lot of options that dentists have now for medically complex patients that are simple, moderately priced, and can be a patient who has a significant challenge can be treated in the dental chair in the dental office. Now, aspiration pneumonia, I'm sure, is a big problem if there's swallowing difficulties amongst the population with people with the various neurodegenerative diseases. As a matter of fact, I know it is. And aspiration pneumonia has been recognized for a long time, but believe it or not, it's only in maybe the past 15 years that have facilities really recognize the importance of maintaining good oral hygiene to prevent aspiration pneumonia. Because it's the bacteria in the mouth that are primarily the ones that the people are aspirating when they don't have good swallows that are getting into the individual's lungs. And it may be very much so that a person that has a healthy mouth can be aspirating and have a little bit of fluid get into their lungs and have no issues with aspiration pneumonia, not ever be hospitalized or have to have any type of antibiotics. Or that individual that has a poor oral cavity, a lot of caries in their mouth, or even dentures that are not kept clean. That bacteria is growing on these dentures. The person aspirates some of their saliva, it goes right into the lungs. So it is extremely important that the dentures be taken out of the mouth, be kept clean, put in solutions, that the teeth be brushed. Those are all important things. And you see all these other areas, people who are immobile, they're more prone to aspiration pneumonia. People have unusual tongue thrusts, and they may have that as the disease progresses, where the tongue doesn't sit in the proper way in the mouth for them to swallow in a proper way. Okay, so this is a big area, and most long-term care or skilled nursing facilities are still not very good at it, at oral care. I mean, my mom has been in just getting rehab. She's an elderly lady, in her 80s, and she has upper denture, and I rarely see them take care of the denture. They take care of everything else, but that is the last thing that gets treated. Fortunately, she has a kid who's a dentist, so you can take care of their mom's teeth. Maybe they just say, yeah, you let the dentist do it, But it's not a high priority. There are so many other things, and so it's an important thing not to forget. And I'll just give you an example, and this is a little child. There's little kids are on tubes and trachs and all these kind of things too. One of my colleagues who's a pediatric dentist had a little kid was getting aspiration pneumonia after aspiration pneumonia, going in the hospital, antibiotics, getting treated, getting better. And they looked and they thought, you know what, why don't you clean his tongue? Because that's part of cleaning the mouth. We have their dentist can give you a tongue scraper to help clean off the bacteria off the tongue. Once they started cleaning that kid's tongue, he had no issues with aspiration pneumonia. So if you're a family member or you know somebody who's having recurrent chronic issues, look to the teeth and look to the mouth, because that bacteria may very well be just sitting there ready to be aspirated time and time again. And we got some pretty cool things. There's disposable toothbrushes. The best thing to do is to prevent aspiration pneumonia is not just to brush a person's teeth. If they're fairly debilitated, have challenges, is to get a suction toothbrush. And that would be basically, a person would get a little suction pump, and these toothbrushes, like here it's from Sage, you can go in there and brush the teeth with a little peroxide. At the same time you're brushing, it suctions it right out. So you don't have to worry about the patient trying to spit, swish, and spit. They may be in a fairly challenged situation where they're not able to do that. So it is a great benefit. And they're not expensive, and you can purchase any of these things over the internet and have your own supply. So that's a big plus. The other thing is, as a person becomes nonverbal and can't speak, they still communicate, and they have ways to communicate. And if an individual is not speaking and has a significant cognitive decline, but if you find that person is putting their hands by their mouth, hitting their mouth, tapping it, biting a finger, all these things can happen as a disease progresses into the final stages. It is important to look into the mouth and see if there's some kind of dental problem going on. I cannot tell you how many nonverbal people I have known that have some type of, they call it a self-injurious behavior, where they're pressing or biting or putting their fingers in their mouth or hitting their hands. You look in the mouth and there's a tooth abscess. So that very frequently, it's to look at these unusual behaviors that suddenly arise, that they can frequently relate it to some type of an infection going on. Okay, so that's a great thing for our dentist to go ahead and look at. Like I say, most of the kids, most people that I see, and now that where the money is at as far as research in dentistry and taking care of kids and oral health, is all in children. It's kind of sad because you know what? Once these people with special needs or any individuals get into adulthood, we have very little funding and financing to take care of adults with special needs and degenerative diseases. Medicare does not cover any oral health, and wouldn't that be great if it did for people with significant health problems? So we can't even go ahead and take care of getting abscessed teeth out, for instance, or admit a patient to the hospital to take out several infected teeth. Medicare won't cover any of that. So we try to do it, and it gets denied on a regular basis. So we don't have good oral health, some type of care. Medicaid is available, but try to find, certain Medicaid dentists can be pretty difficult if a person is on that type of funding. So it becomes very important then for families who have received this type of diagnosis as part of the initial workup to have oral health evaluation and have the mouth taken care of. It's very important because, as things progress, oral health will get kind of on the wayside. So if there's borderline problems, they should be addressed, or teeth that that are never too sure if it's going to last or not, extract it. It's only a tooth. You can chew with a few less teeth. So it is very important to pursue that as part of the initial workup. So dentists are afraid of people with tubes because in dental school we really don't learn it. We learn it, some dentists go on to residency programs, some, where we'll go into hospital dentistry programs or general dentistry residency programs where they learn to work with medically compromised patients. Most of the time in dental school there's not a lot of experience. So when dentists who are in practice see somebody come in with a feeding tube, which many people here are quite familiar with and consider it to be part of daily life, or a person who has some kind of a trach, they don't know what to do. I have dentists who call me, they want to put the patient on antibiotics because they're afraid of infecting the tube. There is no need for antibiotics. The tube is not going to be infected for having someone clean the teeth. The biggest thing is, though, when they're on these tubes, people who have trachs or tubes have difficulty swallowing. That's typically why they're on them. So in modern dentistry, right, we tip everybody back in the chair now. Everybody lays back. And that's the first thing that they shouldn't do, is not tip the patient back. And you should even mention that if you're going to the dentist. He has a tube and he doesn't do well tipped back. They do not do well tipped back with the fluids and everything it's going to create choking. It's going to create coughing and choking and all that kind of problems. And so when the dentist, if you're in the dental office, you get water sprayed all over your face, the drill is going and all that. Those people who have neurodegenerative diseases have a very difficult time managing that water. So the dentist has to take the time, frequent breaks, patients sitting up, maybe not use a water spray, use gauze to clean out the oral cavity so that they're not overwhelmed with these fluids. That's an important thing. But they can all be managed, they can all be managed very easily by a dentist or a hygienist right in a private office. We don't have much studies on adults with feeding tubes, but there's plenty of studies on kids and teenagers with feeding tubes. And this applies to adults too, because you're not chewing and using the teeth, tartar really builds up on the teeth. And that's that stuff that the hygienist is scraping and picking off. It'll significantly build up, almost to the point where it can be covering the teeth. And it's important to clean that off because that is an area where bacteria is just going to sit. And it's going to sit on the gum tissue and cause inflammation in those areas. It's also a risk that having that heavy tartar created a greater risk for individuals to get aspiration pneumonia. So it's important that that's cleaned off. But it's difficult. It's difficult for the dentist, the hygienist to clean off. And frequently, once it's cleaned off, it comes right back. Yet, at least that bacteria, that overload of bacteria is kind of reduced. We get a chance for the body to maintain its health, maintain its immune system health, and improve reduce the risk for aspiration pneumonia. So it's good to get that stuff off of there. It's a little video just showing a person with a fairly significant cognitive challenge and just managing and brushing teeth. Now this guy doesn't really want to have his teeth brushed. He's not too happy about it. But you know, he's there. And that's not uncommon with someone with a cognitive disability. And so see what she's doing. She's taking one toothbrush, the handle of one toothbrush, and he can bite on that. And that can support his mouth while the other toothbrush is used to clean the other side of the mouth. So if somebody gets upset and they don't like you working on them, you know, take a break. You don't have to fight it. You know, it's not so essential. You don't have to clean. Walk away for a while. Let the person relax. Hand holding works very good. They show holding a towel, so he's got something to do with his hands, so he's more comfortable. Keep the command slow, you know, as far as the brushing. Don't do this, do that, go move your hands here, move there. That's too much of a sensory overload. That's way too hard for an individual. So it's one thing, I'm going to brush your teeth and go slowly, take a break, brush another area of the mouth, take a break. It works very well. I mean, I cleaned many people with Alzheimer's disease in my younger years. For probably the first 10 years of my career, I did nursing home dentistry, and we were there every week, once a week, and did lots of dental cleanings. And some ladies liked me and some ladies didn't, but some men wanted to punch me out, and I'd just run out of the room, and then I'd come back in a little later, and they were okay with me, you know. So, you know, nobody wants, let's face it, none of us love the dentist picking and drilling on our teeth. It's not our favorite thing. But we do it because it's part of being healthy. It's part of maintaining, you know, a good health and a comfortable smile. And we want to forget that we have teeth. You know, basically, when our teeth are functioning the best, we don't even know we have them. But when they start hurting or start bothering, and we know we have them, they can disrupt all activities of daily living. You know, the pain is going to make challenges as far as communication. They're not going to, if the person's in pain, they're not going to be able to follow the work with their occupational therapist. They're not going to be able to do the challenges with the physical therapist. It'll take them. The mouth is amazing. How much it can take you down. So, very, very important to spend time. Another thing we have, you know, if you're having difficulty with helping your individuals cleaning, are these open wide mouth rests. And they're just basically a foam insert with a wooden tongue blade inside, and you can put that in there and it's soft. The person can bite on it. You can go ahead and clean on the other side. It's very nice for individuals who are caregivers. And the same company also sells called a surround toothbrush. And if you look at that toothbrush, it actually has 3 heads, a top bristle and 2 bristles that come from the side. And so how nice is that? You know, you don't have to worry about going on the side of the teeth and coming to the bottom and going on the inside. You can just take that toothbrush and go right back and forth. It kind of, you know, covers the tooth and right down to the gum, and you can clean those surfaces. And they are all from Specialized Care Company. They're available on Amazon.com. So you can buy those and have that. And it's a very, very nice toothbrush. I mean, it cleans nicely. I remember when my niece was about 10 years old, I gave her one of those toothbrushes, and she says, "Uncle Bob, can you give me more of those toothbrushes?" And I said, "Why? I just gave one." "Oh, my friends want one. It's a lot easier to brush your teeth." So it is easier. You just go back and forth. The person can bite on it. It's very nice for helping an individual with cognitive challenges to keep their mouth healthy. The other thing are The sonic toothbrushes are nice. With probably the nicest toothbrush, because it's small and can fit in the mouth, is actually the Sonicare for kids. And they will get in there and clean and vibrate and physically clean those areas. And the little air flossers too, that's from Waterpik, that will spray in between the teeth, is an effective device. You know, it's very hard to floss somebody else's teeth. But those little, people ask me about those little sprayers are good. A Waterpik would be difficult for a person who has swallowing challenges, because that's got a lot of fluid going on there. There's a lot of sensory kind of overload intraorally for an individual with cognitive challenges. So I might stay away from a Waterpik. If we were going to get to that level, then I would use a suction toothbrush and clean the person's mouth out. Here are the surround toothbrushes. What are they, $10.69 for a pack of 4. Not too bad a price. Here's the little flossers. There's handles that you can buy those in the drugstore. It's got the handle and little floss you can go ahead and floss a person's teeth. But it's difficult, so like I say, the little water flosser is nice. It works pretty good. I have a lot of regular needs patients who enjoy using those and maintain real good oral health. So, you know, you might have a family member who has had some bridges done. You know, how do you clean those bridges? It's hard, especially, you know, if you don't have any bridges. So that's a great thing to do, to clean underneath it, because if you get cavities under that bridges, I guarantee you getting the teeth out or getting them treated is difficult. And so how do we do that in the office? I frequently have people with neurodegenerative diseases that require sedation, because there's no other way. They may have tremors, they may not have tremors, they may have contractures that you can't get the mouth open, they may have cognitive challenges that they're just not going to let a person go ahead and work in their mouth. And that is a major issue for families, to take their patient to a dentist to have sedation, which is difficult to find anybody more than an oral surgeon that's comfortable with sedation with medically compromised patients. Or even yet, if there is a significant challenge, to have the person admitted to the hospital for the day and have the dental work done. So the preventive care is definitely a big thing, because these are major life events in a person's week. Talk a little bit about people that are in palliative care. And there is, in anybody who has palliative care, that mouth is dry, the saliva is not functioning. There are some nice gels, and the nicest gels are the Biotene products. They have an oral balance gel, which is almost like putting a hand lotion on, but it's for inside the mouth, that you can lubricate the tissues and make the tissues more comfortable. They don't stick to each other. People move, they don't pull, and I don't have that on there. But Biotene it's a popular company. It's sold right over the counter. And like I say, they're called the oral balance gels. There's also some little saliva substitutes. You can squirt a little bit of that in there. They're, again, over the counter. They come in little spritz bottles, and you can help to lubricate the person's mouth. So those are common things. And again, the yeast infections are commonly seen. And there's some medications that can be applied topically to reduce that discomfort. So when you get to the dentist, what are you supposed to tell the dentist? You know, they're going to look and think, can I handle this or not? Your family member may not have been to the dentist in quite a few years. You know, just because life gets in the way, other things are going on, and suddenly you think there's some dental problems that are happening. So remind the dentist that it's challenging for both the dentist and the patient. I mean, in dentistry, we've gotten to the point where many dentists like the patient to sit in the chair, open the mouth, and get started. You know, because that's the business model of dentistry. And if you're in that type of a practice, you may need to search around a little bit for dentists who are comfortable moving at the pace. Because some can very comfortably manage an individual with medical challenges, and others, you can tell, it makes them a little bit nervous. You got to find a facility, if your family member is in a wheelchair, that they're comfortable either fitting the wheelchair into the dental office or transferring your family member from the wheelchair to the chair. And, you know, as far as that goes, The dentist can help, but if you have the tricks and you know how to transfer your family member, then you should be the primary one to do that. But I frequently will go ahead and help. But I often tell dentists, let the family member knows how to transfer their other relative, let them do it, because it's safer that way. And you can bring things like, most chairs open up a little bit. Sometimes the little transfer boards help a person slide over. We don't really get trained in routine dental education how to help transfer a patient. So that can be difficult. We have shorter drills. We don't have to use the big giant drills. They actually sell them to dentists, so they don't have to open their mouth so wide. We have mouth props. They have to be understanding that these are short appointments with breaks. You don't sit a person with a neurodegenerative disease who has a lot of issues for a good solid hour in the chair. The body can't take it. So you have to find someone who's willing to work with that kind of pace. Bring the medications, bring the list of doctors. That's important. Dentists are trained to contact the physicians if they have any issues. There's many new medications I know your families are taking that we're not familiar with at all in dentistry, and what effect it has on local anesthetics, and likely they have very little effect. But many dentists may be concerned with that, so they can go ahead and research that. That we understand that the immune system in the mouth is compromised with any type of chronic disease. And make sure the dentist is someone that you can talk to, that tells what you or your family member finds comfortable or what's uncomfortable, what position to sit in. And you have to be able to get that two-way conversation going, and then you'll know you're finding someone that's going to be able to take care of you. As far as finding a dentist, one good source can be nursing homes in the area, because frequently they have dentists that are going into the nursing homes and often have portable equipment, and may very well be able to come into your home and treat a person, which sometimes is easier when transportation is so difficult, because these dentists have portable equipment that they bring to the nursing home. They may be able to do it in the home. I remember doing home care dentistry quite a few times for individuals. So that's one option. The other option, we have an organization called the Special Care Dentistry Association, scdaonline.org, Special Care Dentistry Association. And they actually have a list of dentists throughout the country, kind of a provider list that are people comfortable with special needs. And, that person may not be the one you're going to choose that's on the list, but there's nothing wrong with calling up and ask, do you know another dentist who works in this area or that area? And, try to build some connections that way. We also have some great preventive products now and one of them are these chlorhexidine products. Yeah, a lot of people, I'm sure, have gotten a prescription for Paradex, this mouthwash that you rinse and reduces gingivitis. Many people are experienced with that. We actually have this product that you can paint on, and that's what's going on there. They're painting on, it's like a little varnish that goes on the teeth. It reduces plaque formation. It stays on the teeth for as much as 90 days. So that's really cool if we can reduce the plaque buildup on someone that's more prone to plaque buildup, having difficulty with oral hygiene. So we have that. We have fluorides to prevent tooth decay. And everyone should have the fluoride, just get the same way we get the fluoride treatment as a kid. Now fluorides, there's many people that are my age remember sitting in the dentist chair and having those trays put in your mouth with all the foam, and you'd choke, and maybe some little kids threw up on it from time to time. That's gone. That's a thing of the past. Now we take a varnish, a thick material, and just paint that on the teeth. So, you don't have to worry about having these big gross foam things. And the kids don't complain too much about it, so it's not too bad. Even on more debilitated individuals, we can take these little chlorhexidine, this Paradex, and put it in a little squirt bottle and spray it in the corners of the mouth. Once a day, that reduces the bacteria buildup in the mouth. And how great is that for somebody who's been treated for pulmonary aspiration, pneumonia with time after time, and you think, why is this person getting this? We go into the hospital, now we're going again with the same thing. Work with the dentist to use these mouth disinfectants. It's far superior to Listerine. Listerine is okay, but there are prescribed that are definitely bacteria reducing. And if things are really bad, we now have a material called silver diamine fluoride. And that's where the person has numerous cavities. It's a material that we can paint on the cavities, and this would be for a significantly ill patient or someone who could not get to the dentist. And where it's become popular is working on little 2- and 3-year-old kids that are just a nightmare to treat. And you can paint this on the teeth, on the cavities, and it will arrest the decay. And it can last 6 months before that it would have to be placed on those areas again. It turns the teeth a real dark black color, but how nice is that if the decay can be stopped and the person is not sensitive? We have the issues with these dark colors, but it can get them through a time period until they can have more definitive care or the child can actually get to the dentist. So it's not a bad treatment, and it's common here in the United States, and dentists, it's common in the pediatric dentistry population. It's been in the United States for, say, 5 years. It's been all over the world for many years. So we're just catching up with the rest of the world, like most things we do. And that's pretty much it as far as what I can think of. Wouldn't it be nice if we could all chew that quick? Well, we did at lunch today, I think. And if you have questions, I'll be glad to take what I can take as far as challenges. Is dentistry an issue? Is it hard, or do people are?
My husband was already in a wheelchair. Finding a dentist who would work on him in a wheelchair took a couple years.
That's what's crazy.
By that time, it was crazy, but by that time, his teeth were pretty bad, and he was well along his way in PSP.
Yeah.
Found one in Hinsdale that would. I'm from Burr Ridge, Illinois.
Sure, yeah.
But really difficult finding one who will work on a wheelchair.
And he wasn't that hard to work on, I'm sure. When he was in early progress of the disease, he sat still and opened his mouth. And
Right.
The dentist just has to stand.
Right.
You know?
I think also it's the setup of the dental offices with those big chairs in them.
Yeah.
They don't have a room set up for someone wheeling a wheelchair into them in
True.
a lot of cases.
Now, believe it or not, those chairs slide out of the way. They're basically not bolted to the floor. We have a room that I bring people that are in stretchers, and we just take the chair and slide it out of the way, and then they're there. So now some of these offices are so small. You got to find some. That's a challenge. And the dentist wasn't willing to do the transfers, huh? Nobody.
No.
No. See, the dentists don't learn transfers, but it is possible to transfer individuals. I can see that to be, our dental operatories are small, so you got to find someone who's got a little better dental operatory. But we are very good at treating patients who can get to us and get in our chair. And that's a big part, as far as in my practice, we bring dental students in where they learn about transferring and seeing special needs. So maybe we're getting a little better at it with time, and you'll see that with the younger dentists, but.
This was an older dentist, so when he retires, there won't be anyone in our area.
No, there's not too many. That's the sad thing about it, that are replacing that. Maybe he'll sell his office to somebody that's like him. I hope.
Maybe.
Yeah. For the group, is aspiration pneumonia an issue where people are getting hospitalized a lot for that, or is that's not such an issue anymore? Not as big of a problem where people are running into. That's good. It was a big problem, especially in people who are on, like I say, any type of tubes or ventilating equipment. Yeah, question in the front, yeah. I think you got to get the microphone, though.
My husband has an issue with front teeth that weren't terribly stable to begin with, and the one is actively loose. He's 2.5 years into diagnosis. Are implants a viable option? Should I look more into bridges? Do I just let the tooth go?
I would say if a person had unlimited funds, then the bridge is probably the better option. The implants can take a significant amount of time to integrate. There also is immune system challenges, and who knows what other immune system issues are going along with some of these diseases. Taking the tooth out, if he's uncomfortable with, if he's comfortable with that, could be the very best solution because the problem is not there. The bridge can be a challenge to place that, as far as the strength of the adjacent teeth can also be a challenge. People with neurodegenerative diseases can wear partials, that are the removable, as long as they're maintained. They can wear those.
Yeah, well,
So
he wears glasses, and I'm at the
he's having challenges with glasses already.
Yeah, well, we fall a lot.
Yeah.
And he has 2 pair, and sometimes I'm taking both pairs in at the same time.
Yeah.
And so I'm not sure how a partial is.
Right, exactly. A person that's prone to falling, you start doing all that expensive bridge work, they were to fall on their tooth, they could fracture a pretty big area. So sometimes the best, and it's the toughest decision, is to remove the loose tooth and just be able to enjoy eating without it, because it won't be frustrating, and you'll have, something there.
Okay, thank you.
Yeah. We're good. We're good. Thanks so much. Thanks for having me.